First of all, thank you so much for your kind introduction. And secondly, of course, congratulations for the Congress. It's a very interesting, great Congress, and so great to be here with you. So let's have a nice view what we can do with TADs and aligners. So we saw very interesting lectures in the morning, and after seeing these lectures, I think many people see, I don't need TADs. I can do everything with aligners. We can close open wide, we can distalize, we can mesialize, we can even treat extraction cases, but maybe this is just half of the truth. So we have to consider the following points. First of all, how many aligners are needed? And if you have maybe 100 or even more aligners, the patient has to wear the aligners 3 or 4 years. So maybe this is not as much as most of our patients want to wear aligners. How much compliance is needed? How much do we need elastics, class 2, class 3 elastics? And last but not least, we saw some cases with severe open bites. We saw up and down elastics, and I think we have to think about the risk of root resorption of the anchorage of the incisor teeth. So this was an open bite case treated by a colleague of mine, and the goal was to intrude the molars, and the front teeth has been used as anchorage teeth. Up and down the elastics have been applied, and this is before and this is after this treatment. So of course, as soon as we are using teeth as anchorage, we can have always the high risk of root and resorption, especially if you have up and down elastics. So without any doubt, there are some very difficult treatment goals like distalization, bodily distalization, especially mesialization if you have missing 6, missing 5, or even missing anteriors, or molar intrusion. And I like to speak about these 3 treatment goals, and maybe TADs can help us to accomplish these goals a little bit better. So what is the strategy I like to show you? The strategy is to first use mini implant-borne mechanics for these purposes like distalization, mesialization, molar intrusion, molar uprighting, and then after this treatment goal is achieved, we have an easier case that we can finish with aligners. So right here we have for aligners a difficult case. We have almost a full class 2. We are going to distalize, and again after distalization, in this case after 7 months, it's an easy case for aligners, and now we can just do minor things. So what are the advantages? Of course, we have a bodily distalization using these kind of devices, and it's not visible. Okay, we saw a very good lecture of Louis Carrière, but you see the class 2 mechanics. If you have palatal distalization mechanics, especially adult patients really appreciate that the appliance is not visible. You don't need any compliance, just all hygiene. And last but not least, we don't see dental side effects in terms of anterior protrusion, nor of the anterior or of the lower teeth. And at the end, after this, we are going to finish this case or these kind of cases with aligners. So our favorite insertion site, and from my point of view, this is a future insertion site for mini implants. This is the anterior palate. Why? We have a very high success rate. This is almost like in dental implantology, so the rate of the failures is very low. The risk of root damage is very, very low. The TADs are not in the path of the moving teeth, so we can distalize, we can mesialize, and the TADs are not in the path of our moving teeth. And last but not least, and that's what we are all here for, we have an invisible mechanics. So this was one of our first papers we published on mini implants in the anterior palate, and we love this area. You can use it for distalization, molar anchorage, molar mesialization, rapid maxillary expansion, or even in those cases where you have impacted tooth, you can align those impacted teeth and maybe finish the case with aligners. But where to insert the mini implants in the palate, and this is one of my favorite pictures. It's very easy to see where you find bone and where you don't find bone. So these red areas are no-go areas. Why? There's almost no bone. So try not to have a good anchorage in this area. Anteriorly, we have the rugae, we have the roots, so this is a no-go area as well. So at the end, we have this so-called T-zone, and this T-zone, it's very easy to identify clinically. It's posterior from the rugae. So always have a look at the rugae and stay posterior in this T-zone, and you find a good bony area for your mini implants. So it is better to put the mini implants median or paramedian. There are many of colleagues putting them in the middle. However, Björn Ludwig, for instance, my good friend, he puts them paramedian. And we did some research on this topic and wanted to know what is better. Are they better more stable in the middle or more stable laterally? And the interesting outcome is there's no difference between median and paramedian screws, even in young patients. So from this point of view, from the point of stability, it doesn't matter at all. So you can either insert screws in the middle or laterally. These are two sisters. Both needed some space for the canines, and both were very happy with their distalization mechanics. Right here you see a patient with paramedian screws. So from our point of view, it doesn't matter if you put them right in the middle or laterally. So let's have a look about our sliding mechanics. We can use it with one mini implant or with two mini implants. Mostly I prefer to use two mini implants since it's a little bit more rigid and the tendency of tipping of the mini implant is much lower. So let's have a look at some patients. This is an adult patient. He was 17 years old with severe crowding. Two mini implants always stay posterior from the rugae. This is the slider in place. And after 7 months, you see many small spaces, not a big space. You see, please have a look at the canines. They are almost moving distally. And this is why. This is due to interdental fiber. It's a little bit like a duck family. You are distalizing the molar, and all the small ducts are following. We knew this effect, of course, from headgear. So this is no news. But this is very helpful for us. And it's now much easier to finish a case like this now with aligners. After distalization, you remove the distalization spring, and now we leave the appliance for anchorage purposes, that the molars are not going to move mesially again. This case was finished with brackets, but of course it's also possible to finish this with aligners, as I'm going to show you in the next couple of slides. So this was at the end, before and after, in this case, without any class 2 elastics at all. So this is how the slider is applied. We need some pre-drilling only in adult patients. In young patients, no pre-drilling is needed since the bone quality is not so high. It's very easy to assemble the mechanics. You don't need no welding, soldering. All you need are bands with palatal sheaths. So if you want to, you can install the mechanics in just one appointment. This is the plate. This is adapted. And the whole procedure takes around about 20 to 25 minutes for two mini implants that are inserted and banding of these plate. If you want to, you can take an impression and, of course, adapt it on the lab. If you want to see the longer version of this video, it is easy available on YouTube. Okay. Now everything is assembled and it looks like this. The slider is fixed on top of the mini implants. Now it comes to the last step, to the activation of the mechanics. So not a big thing, to be honest. So we can combine it, of course, this slider with lingual mechanics. I went to lingual meetings in Germany now for 8 years. I think the number of attendees is decreasing. On the other side, attendees of meetings like this is increasing. So what I like today very much to combine it with Invisalign or any other aligning, finishing appliance. So first step, again, we are distalizing with our sliding mechanics, then we take an impression or we are scanning the situation, and after that we are finishing the case with aligners. So let's sort of have a look at the patient. Okay, this was one of our first patients. We have first distalized with the slider, and after that took an impression and have a look at many small spaces, not a big space. This is a situation after 7 months of treatment. Take an impression, and this is the finishing with aligners. So I think maybe it's a nice opportunity for our class 2 patients if the problem is just in the upper arch. Of course, we saw some problems. Problem number 1, we had some problems with Invisalign since they didn't want us to take an impression if the band is still in place. And we wanted the bands in place to anchor the molars. So what we are doing now, if we want to finish the case with Invisalign, we are using these bonded tubes. And this is well accepted now by Invisalign. So you can take an impression and leave these bonded tubes in place for molar anchorage purposes. So this is the case, for instance, with these bonded tubes. So how can we combine in the phase 2 our Beneslider with the aligners? We can have to deactivate the slider. We don't want to distalize more. We just want to keep the molars in place. So we can remove the spring, as you can see right here. There's no spring anymore. Or we can use this steel ligature. This is a very easy way to transform your active slider into a passive molar anchorage device. You can cut out this area to have not a big interference with your aligners, or the other opportunity that this bonding area is just covered by the aligner. So both is possible. So it's now, I think, very easy to combine these kind of mechanics with our aligners. So some tips for you if you want to start next week with this, from my point of view, very interesting combination. If you take an impression with PVS, it's very recommendable to use some wax. Otherwise, you are not able to remove the impression, of course, anymore. Second tip I like to give you, the ClinCheck comes back. And of course, ClinCheck mostly recommends tooth-by-tooth retraction. But this takes, of course, much more aligners compared to retraction of all teeth together. But we can, of course, retract all teeth together. Why? We have a good skeletal anchorage in place. Okay? So we can reduce the number of aligners, in this case, for instance, from 36 to 20. We want to save some time, and the patients are happy since the treatment is finished earlier. So we distalized. Of course, we can also mesialize, and I know this is very difficult and almost impossible for aligners. So this is the Mesialslider, and the Mesialslider is similar to the Beneslider, but we are not using open springs, we are using closing springs. And it's a really easy mechanics as soon as you have a missing 6 or missing 5. This is, for instance, the case with missing 5. You have a good root parallelism in the lower arch. We used brackets since we have missing a second premolars as well. Another case was missing 6. It takes some time, to be honest. This took around about 12 months. But for the patients, it's a very nice opportunity if you have wisdom teeth in place. This is after removal of the appliance. This is after 3 years in retention. Another case was a Mesialslider. In this case, we had missing laterals, and she was treated by another orthodontist. He mesialized 3 and 4 to insert dental implants in the area of the first bicuspid. But, however, what happened, you can see it very easily. There's not enough space for dental implants, and we have this problem many times if we have the situation that we are opening the space for dental implants at a later stage. So my recommendation in this case, we have wisdom teeth in place. Let's mesialize all teeth. And as soon as we are mesializing bicuspids, we are using again these bonded tubes according to Dr. Banach, who was the one that invented these bonded tubes. And you see the treatment outcome of this patient, and this was after around about 11 months of treatment with the Mesialslider. Again, now you take an impression and finish the case, in this case, with aligners. And this was the treatment outcome in this patient. Of course, you saw distalization and you saw mesialization. We can combine it, and this is one of my favorite appliances. We call it mesial distal slider. And you can mesialize on one side and distalize on the other side. It looks like a miracle, but we can do many things without brackets. And again, of course, after you have done these tough jobs, you can finish again this case with aligners as well. So again, this is our strategy to transform a difficult case into an easy case and finish it with aligners. So the last topic of my lecture today will be molar intrusion, another, from my point of view, very difficult task. And we used to start with mini implants in between the roots. However, sometimes there is not enough space, and I'm afraid to touch a root. So the anterior palate is, from my point of view, the better opportunity to insert mini implants. We call this appliance Mousetrap, since it looks a little like a mousetrap. And it's a very easy mechanics. All we have is a TPA and a lever arm. And this lever arm is an intrusive force. And you can easily adjust it to 100 grams for each molar. And you have a very constant intrusive force. You can use this for over-erupted molars or for open bite cases as well. So I like to show you one case with an over-erupted molar. This is a mousetrap. Again, very easy mechanics. There's the TPA and this lever arm. You don't need to take an impression. It takes you around about 15 minutes to install this appliance. This was one of the patients of my good friend Jörg Schwarze. We have many patients together. He is in Cologne, which is city next door to Düsseldorf, and we have many patients together. I'm doing the mini implant things, and he is finishing the case, and this was one of our joint cases we are treating together. So after intrusion of this molar, he's taking he's doing the scan for finishing with aligners. So if you are interested, we are just using this appliance, the Mousetrap, also for open bite cases. This is just published recently. However, I don't have so much time today to show you some more of these cases. So 1.5 minutes left. I'm perfectly in time, so I'm coming to the take-home messages. I think TADs and aligners, they could be a very good team, and especially for the difficult things like distalization, not just 1 or 2 millimeters. If you need maybe 3 or 4, I think TADs can help us very easily. And the good thing about these appliances, they are not visible, okay? And especially adult patients, they really appreciate. And last but not least, of course, for molar intrusion as well. So we are expanding the scope for aligners. We are expanding the horizons for aligners. So if you want to see some more mechanics, some more how to use mini implants in the anterior palate, I'd like to warmly invite you to the users meeting we are doing every year in Düsseldorf. This is the 7th user meeting. Düsseldorf is a very nice city, very easy to get there. And nowadays we have many mini implant systems for the anterior palate. So from my point of view, this is not just a users meeting for the benefit system, but also for every mini implant system using the anterior palate. We have a starter course as well. So, and this is, from my point of view, a very the most interesting video I like to show you at the end. Some of the doctors are afraid to insert mini implants, and of course I was when I started as well. So I really could understand this. And maybe the last video will help you a little bit. Some of you know maybe this video. This was 2 years ago at the 50th anniversary of the South African Society. And this is my partner, Susanne. And just to show everybody, this was in a lecture hall like here. And just to show that it's very easy to insert screws in the palate, she has inserted a mini implant in herself, by herself. So Susanne, congratulations. Good job. So it's very, very easy. No roots, no vessels. Of course, this was a mini implant with a diamond in place, okay? So if you want to see it, it's still in the mouse. She's still very happy with it, just to show you that it is very easy thing. And have some courage. Take it home to your office next week, and don't be afraid to insert in the palate. It's very easy. This is our website from our university. Thank you, European Aligner Society, for invitation. Thank you so much for everything. And if you want to see some more information, maybe you know this QR code. If you take a picture, you are not allowed, but if you take one, you will be guided to our website. Thank you so much.